Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Types of alpha receptors. Alpha receptors are of two types, alpha 1 and alpha 2. So first alpha 1. Alpha 1 is a post-junctional receptor. It is a post-junctional receptor which are present on effector organs. Whereas alpha 2 is a pre-junctional receptor, and this alpha 2 is a pre-junctional receptor present on the nerve endings like alpha 2. Alpha 2 is also a post-junctional receptors, and it is post-junctional receptors in the brain or placenta or pancreatic beta cells, whereas actually it is post-junctional receptor in brain and pancreatic beta cells, whereas it is extra-junctional receptors in the platelets. So post-junctional is post-synaptic receptor, whereas pre-junctional is in the presynaptic terminal. If the receptor is present, then that is pre-junctional. So alpha 1 is a post-junctional receptor on effector organs, whereas alpha 2 is pre-junctional receptors on nerve endings. It is post-junctional receptor on brain and placenta, and it is extra-junctional receptor in the platelets. Then actions of alpha 1 and alpha 2. Alpha 1 on the genitourinary smooth muscles, it causes contractions. So as a result, it will prevent the micturition of the bladder, leading to urinary retention. It will cause constipation also. So this alpha 1 causes vasoconstriction. It is important in gland secretions and gut. It causes relaxation of the gut, and it results in liver, it causes glycogenolysis, and in the heart it results in arrhythmias of the heart. Whereas alpha 2 is important in vasoconstriction, it causes gland secretion, and it inhibits the transmitter release, and in the gut it causes relaxation of the gut. In the liver it causes glycogenolysis, similar to alpha 1. Even alpha 1 causes glycogenolysis, alpha 2 also causes glycogenolysis. In the heart it results in arrhythmias, it decreases insulin release, and it causes platelet aggregation. Then alpha 1 and alpha 2 drugs are selective agonist of alpha 1 is actually phenylephrine, and also methoxamine is an alpha 1 agonist, whereas alpha 2 agonist is clonidine. Whereas selective antagonists are alpha 1 selective antagonist is prazosin is a selective alpha 1 antagonist, and yohimbine is a selective alpha 2 antagonist.
thank you and thank you for watching.